Good morning, official welcome to the Public Engagement Symposium. It's a great pleasure to speak on behalf of the network. The planning members I will introduce and thank at the end of my very brief talk. I'm just going to give you a little bit of a background on the network and our Pathfinder project, which was engagement. And just to bring us into some sort of context in terms of history, in 2009, you may recall that the government restructured the province's research organizations and created the Alberta Innovates corporations. And the one that I'm most familiar with, of course, and I see some of you here from that corporation today, the Alberta Innovates Health Solutions Group, decided to pull together some organizations to talk a little bit about what we could do in terms of trying to have some impact with research on health policy and practice. And that was really the creation of the Collaborative Health Innovation Network, which we fondly called CHIN. Have to have acronyms. And in order to sort of test the concept of this network, we thought we should really look at trying to do something. And for those of you who've been in the network business, I guess I call it, and Kirby and I were just talking, networks seem to be the answer to a lot of things these days. But once you get everybody together, you sit around the table and you say sort of, well, now what? And we actually had a number of groups. They weren't all health focused. Some other organizations were at the table with us, and we did a bit of brainstorming. What's something that's common to all of us, a challenge or an area that we'd like to pursue further? And we decided and settled on public engagement. And at the time, I was with Alberta Health Services, and I had a team that I was leading that was trying to develop a framework around clinical engagement. I was also working very collaboratively with folks on my team that were looking at patient engagement, people in the room, community engagement, stakeholder engagement, you name it. Engagement and public engagement sort of came up. There's something that crosses all of our interests. And how are we doing it? So again, sort of common practice for groups that are just getting to know each other is to develop a way of understanding what's out there, what's best practice, what's worked, what hasn't worked. And then we were lucky enough to have some funds provided to commission the Cheris Management Consulting. We asked them to do an environmental scan and to identify frameworks, best practices, etc. We were looking more closely, though, at the time at how has public engagement been used as a knowledge transfer, knowledge mobilization tool. And as I'll tell you in a minute, that turned out to be fairly tough, because it was hard to just even get to what is public engagement, stakeholder engagement, etc., before we can even move into the knowledge component as a tool. I'm hoping some of the speakers may talk about that later today. The scan mapped out the current landscape of public engagement and again, with some focus on knowledge translation. And so the resulting report, called Public Engagement Knowledge Translation Environmental Scan, Final Report Phase 1 and 2, September 2011, and has been updated in December of 2011. It describes examples of public engagement best practices internationally, nationally, provincially, locally, and then Alberta specifically. And that report it was a typical literature search organized into categories such as frameworks, the evidence, examples of projects and practices, and strategies and tools. And so when the network received that report, we thought we might want to narrow it a little bit and look at processes and tools and look at a subset of examples so that we could get our heads around. It was such a broad, and as many of you know, hugely broad area. So we had some key informant interviews, and there were 6 altogether. First was called Engaging Queenslanders. We did one on Department of Planning and Infrastructure in Western Australia, Alberni Valley Children's First Network, the Citizens Reference Panel on Ontario Health Services Land Use Regional Plan. So again, as I mentioned, this wasn't just health focused. Edmonton's Citizens Panel on the City Budget. So those 6, there was a deeper drill down with intentional interviews to actually understand more about what took place, what worked, what were the common themes. After that, the common themes across those 6 similarities and differences and issues, etc., came from that, and that's also captured in the document. I believe there's some hard copy documents out on the table. Dawn is nodding her head. And as well, I'm sure there's an electronic format for folks to look at. But again, because we were committed to knowledge translation and knowledge mobilization, just handing somebody a 2-inch report there's no way that you're going to really know whether that had an impact, if it was useful or not. So the committee or the network decided to have this session, this symposium, to be able to have some discussion. So the purpose of today is to really provide overviews of best examples of public engagement strategies based on what that group that we collaborated with in development of the scan, and to share, to learn, and co-create new knowledge about this topic. Identify some tactics and tools. I believe that we have the panel that's going to really focus on some of the tools of the trade. Look at challenges and pitfalls. Give you an opportunity to share your knowledge. We knew that when we did this scan, we were not covering, like I look at Willow, the patient engagement strategy for Alberta Health Services. There were so many things that I know all of you can bring to the table to say, well, this is what we've been doing. We didn't capture that in the scan, so this is an opportunity to share your knowledge. And as well, who knows, you may want to look at getting together again and having perhaps a community of practice or some sort of, but not a portal. We talked about that. Seems like portals are the answer, but not necessarily, but just continue the conversation to stay connected with each other. Why reinvent something if someone else has gone there and had great success? And we know that it's really critical to get the input, the buy-in, and the collaboration with our stakeholders, our clients, our patients, whatever we may want to call them, and ourselves be involved in those initiatives as well. So before I close, I'd like to acknowledge and thank my colleagues on the planning committee. If you're in the room, you can wave or stand. Krista Harstell, Murray McKay, Charlene Stayberg, Kelly Deese, Kathy Klassen, Kathleen Thurber, and Donna Agnes. Thank you very much. As well, behind the scenes, Elaine, Christina, and Dwayne from Alberta Innovates Health Solutions for all of your work to put this together. Thank you to the sponsors, Alberta Innovates Health Solutions and the Institute of Health Economics. And thank you to the speakers. I know that some of this programming took place in the last few hours before the event, which tends to happen, but appreciate your willingness to join us today.